I think healthcare providers, number one, should not assume that that Latino speaks English, okay? Or number two, that that Latino speaks Spanish. If that patient speaks Spanish, then obviously I need to make sure that I have somebody on staff that can interpret for that patient. So it's important that as a healthcare administrator or the provider have in place a system, a testing system, to make sure that those individuals are in fact bilingual, those individuals are in fact able to communicate in that language of that patient. They could be from El Salvador, Guatemala, and they could be speaking certain other dialects, and if they're not aware of those dialects, and you get into kind of medical error kind of scenarios, which puts the healthcare provider at risk. Not only the healthcare provider, but also the patient. If you're going to use a family interpreter, you have to advise the family that they have a right to a professional interpreter. So that's to safeguard the healthcare provider, right? Because you're kind of, in a way, leaving that option available. But I strongly recommend that family members not be used.
At the hospital, they had a formal interpreter come to interpret for the doctor, who was the hospice doctor there for Kaiser. But at self-help, it was a bilingual staff by the professional from each discipline. My mom was very comfortable with that. The nurse spoke Cantonese, and she had questions about what it is like at the end of life, you know, what suffering would she be going through, what would be some of the, you know, and how to minimize that suffering. And the nurse was able to comfort her and reassure her in her own language and understanding the cultural background. You know, if I were to translate, if they did not speak the language, there would be a breakdown in the translation process, and she would not talk as much or express herself as much.
At Capital Hospice, we try not to use family members or children as interpreters. This is definitely against what we call the continuum of care, and I consider hospice as part of a continuum of care. So there's a continuum of care cultural competency ladder, and most people may not be aware of it, some may be aware of it, but that continuum goes, it starts from the bottom, it goes something like, there's a cultural destructiveness, there's cultural inadequacy, then there's cultural, what we call blindness. And most of the culture that we live in this Western USA is on the blindness scale. So using a child to translate would put you all the way in the bottom of inadequacy, which means that that organization is not ready or not prepared to deal with any cultures, any differences at all.